Welcome, everyone. I want to welcome everyone to this webinar. It's good to have minds like this sitting down to discuss very topical issues. This webinar, which is on poverty and targeting in crisis, mixed methods and looking at policy direction. Is a very interesting topic advices on different fronts, whether in the north or in the south. There are multiple crises that they're becoming quite complex and challenging to address, not only for government, but also for INGOs and humanitarian actors. So I think this to have this webinar at this point in time, it's a very important and critical one. And for this, we have two papers, very well-researched papers. Open crisis in Borno State. Borno State is in the northeastern part of Nigeria. We had the Boko Haram crisis, and that will be presented by Vidya. So Vidya, I can only just mention. We also have a second paper, which will be by Fred. I can see Fred already looking in the camera there, which was on targeting social assistance in Nigeria. This paper is a very important paper targeting for the National Social Register in Nigeria. There's been a lot of political contentions around the register. So
Victor, I think we've lost you. Great, but I think we got the gist of that. So thanks for the introductions, Victor.
Yeah, your last.
Oh.
And so those are the two papers we'll be having. My name is Victor Duku, the Senior Social Protection, and it's good to be joining you in this webinar. Thank you, and over to you, yeah.
Great, thank you so much for that introduction, Victor, and setting the scene a little. So as Victor mentioned, I'll be speaking today about some research we've been doing in the better assistance, social assistance in crisis context in Borno, but then also extrapolated to wider Nigeria as well. So this is a mixed method study which is undertaken collaboratively with partners, include some of which I think might be on the call today, who include the DRPC, the Development Research and Practice Center, and CSEA, the Center for the Studies of the Economies of Africa. And it's supported by two FCDO-funded programs of work, including BASIC, which I've mentioned, and DEEP, which is the Data and Evidence to End Extreme Poverty programs. So I'll just share my screen and speak to a couple of slides, a couple of key points that I'd like to draw your attention to with regards to this today. Let's figure out how to do that. Okay. Perfect. So I think you should be able to see my screen now. Yes, I see Fred nodding. Thanks, Fred. So as I mentioned, the study is really focused on understanding the movements of households into and out of poverty and their experiences with social assistance amidst complex crises in Nigeria more broadly, with some studies within this project focusing on Borno State, as Victor mentioned. So the objectives of this wider study is multiple. So the quantitative analysis that this study incorporated sought really to understand the relationship between poverty, dynamics, and complex crises in Nigeria, as mentioned. And the crises that it's especially focused on included violent conflict, climate-related disasters, namely flooding and drought, and COVID-19 and other economic crises that have been springing up in more recent years. The qualitative data in turn sought to examine the sequences and pathways through which crises affected people's movements into and out of poverty, and attempted also to draw out then implications for social assistance. All of this, I should mention, are emerging insights. And will be represented shortly through publications in various stages of review and publishing as well. So the quantitative data, very briefly, given that this is a mixed method study, I'll just briefly outline the types of data sources we relied on. With the quantitative data sets, we relied on secondary data comprising a households level panel survey, so a longitudinal survey between around 2010 to 2019. And then we merged this household level data with data on the presence of different types of crises, so of conflict fatalities, of the presence of precipitation, of floods, and so on, to get at some of those climate-related disasters as well. And then what we did as well is we looked at undertaking a new quantitative survey that's which drew attention to in Northeast, in Borno State especially, and within Borno in 2 LGAs. And the purpose of this survey was really to understand the salience of different types of crises, the disruptive effects they had on households according to household perceptions and reporting, and then also how households were able to access variably different types of social assistance and support. Alongside this quantitative element, in the qualitative data, we, in a subset of locations spanning the 6 geopolitical zones, so across 6 states within the 6 zones of Nigeria, we undertook a series of life history interviews, of focus group discussions, and key informant interviews to attempt to, again, triangulate, better understand the sequences and pathways alongside the relationships and associations more broadly. So with that methodological snapshots shared, let's go into some of the results from this work. So what we see is, very briefly and descriptively, quite a bit of spatial variations in the presence of poverty dynamics, as well as in the presence of different types of crises. So in the figures, the maps on the top in blue, what you see is relative poverty trajectories. So households that were consistently in the bottom 2 expenditure quintiles in the country. So were amongst the 40% of the poorest households in the country, are especially pronounced in the northern zone. So this is the first map in the top left on chronic poverty. Similarly, transient poverty, so households that fell in and became remained impoverished, households that repeatedly moved into and out of poverty, churning around the poverty line. This was also quite present in the northern zones. Instead, in the south, the relatively richer parts of the country, as would be expected, you see relatively more rates of households who have never been in poverty, those who have escaped and remained out or sustained those escapes from poverty as well. And mapping onto these more negative poverty trajectories in the north, what we also see is quite a strong presence, as we know, of Boko Haram related violence. This is the map in the bottom right, the red circles. So violent fatalities related to Boko Haram conflicts, related violence. The farmer-herder conflicts and related violence are the orange circles in the bottom right map, and so on. So there's a confluence of these instances of violent conflict that somewhat overlap with these experiences of chronic poverty and of impoverishment. We also see similarly when we look at flooding or drought, again, quite pronounced along Nigeria's middle belt, where again, some of those experiences of transient poverty and the chronicity of poverty were especially prevalent. So in the time I have left, I'll share some emerging messages from this work and structure it across 4 or 5 key points. A first key point is that what we're seeing is that chronic poverty, so long-term persistent poverty of households, is becoming more acute. It's becoming deeper against this backdrop of complex crises and wider structural challenges. So when we look at the quantitative analysis, for example, what we see is that amongst the bottom two, so the already poor quintiles pre-pandemic, what we see then is that households in these bottom two quintiles were more likely to report worry of drought or delayed rains affecting their welfare. They were more likely to pay more than the official price for petrol, as these graphs shows. They were also much more likely over 2020 and 2021, so the pandemic waves, they were much more likely to engage in a distressed sale of assets as well in response to the pandemic. So we see these different confluence of climate, economic crises, of the pandemic as well, especially pronounced amongst the bottom two quintiles, amongst households already in poverty. So that's the first key message. A second message is that in addition to the chronicity of poverty becoming more acute or deeper, what we also see is that the impoverishment that otherwise non-poor households have experienced in this period is becoming more sustained. So an example here is from a life history that our team had conducted in rural Borno in the Northeast. And what we see from this interviewee is it's a woman who experienced a series of both covariate and idiosyncratic shocks. So she was originally for much of her life churning or just above the poverty line, falling a little in, but remaining out for a long period of time. But then in the last 10 or 12 years, she's experienced sustained impoverishment, which is ultimately over this smaller period, quite chronic poverty over a decade. And if we interrogate why this experience came to be, we see that first, for example, in 2013, her husband and some of her children were killed in Boko Haram related violence. Her arm was amputated as a result of gunshot wounds, which altogether depleted her savings, limited her ability as well to engage in income generation beyond the horrors of the violence itself. We see then, in addition to this, that this crisis and ill health crisis especially contributed to her displacement. She was living she was able to secure land on which she was able to live in a tent for some years. There was, again, violent conflict, killings, trauma, farmland being left behind. And then on top of this, there was the pandemic, there was the cashless policy, which is another economic crisis that's been especially prevalent over the last couple of years, and drought on top of this. So she was unable to undertake certain income generating activities due to the cashless policy. Her children were unable to help support her as they otherwise would have on account of drought, and she also suffers from ill health. So it's really these intersecting multi-scalar crises at different levels of society, multiple displacements, the negative, harmful impact, in fact, of monetary policies, which created this environment which resulted in her immediate impoverishment then being sustained as her resilience capacities were sequentially eroded. There's also, she did receive social assistance, but the adequacy of that is something that we'll come back to towards the end. Our results also showed very briefly, which we can discuss in the discussion period perhaps, that certain groups in our qualitative and quantitative insights faced particularly severe effects of these crises due to specific vulnerabilities. So for example, internally displaced people often lost their social networks and experienced some of the worst effects, especially at the climate conflict nexus, which prolonged and deepened their poverty. Women in poverty also saw their pathways of escaping poverty subverted in many ways due to the harmful or maladaptive economic policies against a backdrop of certain adverse social and gender-based norms as well. So then the question emerges, has social assistance or other policies been effective in helping mitigate the effect of these various conflicts, disasters, and economic crises? And what we see is that social assistance has helped some households reduce their depth of poverty, including in response to crises. So for example, this graph on the left is taken from the Borno survey that was conducted last year in 2 LGAs in Borno. And what we see is that when we look at the intersection of households that reported conflict and climate-related disasters resulting in a loss of assets or in lost income and so on, that they were slightly more likely to have received social assistance, but not by much. And overall, if you look at the numbers on the axis itself, on the left, on the y-axis, the rates of social assistance coverage are strikingly low. We see this also then if we take a step back and look during the pandemic time, access to social assistance was a bit, had some varied coverage at the onset of the pandemic, but then leveled off a bit over time. And then in the qualitative data also, what we saw is quite a bit of scarcity around social assistance amongst people in poverty. So people often viewed it as an abstract.
Sorry, Vidya, if I may come in, you have just 2 more minutes.
Perfect. Thanks for letting me know, Victor. I might take a minute or 2 more if that's okay.
Okay, that's fine.
Thank you. So yes, it was viewed as an abstract concept with rather limited understanding of what it entails or how it might affect them. Another insight around social assistance access was that the type of crises that merited this type of assistance or that was perceived to merit this type of assistance, whether it's social assistance or humanitarian aid as well, the type of crises garnering this relief slightly varied. So for example, we saw in the qualitative data instances of land disputes where the government intervened and helped to resolve land issues. We saw in terms of flooding, there was some access to government support. And in the quantitative data, we also saw that during the pandemic, households residing in areas of farmer-herder violence saw their receipt of assistance though decrease over time, whereas those in areas of Boko Haram-related violence saw a slight rise in their assistance between 2020 and 2021. And this is slightly related as well to the last reflection around social assistance, which is that there was, in the qualitative insights, a relatively limited delineation between social assistance on the one hand and humanitarian aid on the other. So this might also reflect the fact that a lot of this assistance is being channeled through the Ministry for Humanitarian Affairs and Social Development. So that institute itself might then have implications for the allocation of assistance. So the next point is then, okay, so this is certainly a situation of complex crises with limited assistance, with quite severe impacts on people's poverty and well-being trajectories. So the next question is, how are people managing to escape or even remain out of poverty in these challenging contexts? What we see when we look at these instances of sustained escapes from poverty is that sustained escapers have benefited from contexts relatively free of violent conflict, even if other forms of crime or economic crises have permeated. And how they've managed to sustain their escape is by adapting to changing circumstances, supported by a few points. So for example, in this life history, what we see is that the individual experienced a series of crises, including multiple armed robber attacks, theft, economic crises as well related to the pandemic, the cashless policy. But she was able to remain resilient due to the multiple income sources she had developed over time, due to spousal collaboration. Importantly, also, she received information ahead of time about the cashless policy, which was pivotal in enabling her to withdraw money from the bank in time, while her bank ownership itself and access to ATM facilities made her life easier amidst crises and enabled her to remain resilient. So in other words, the adaptation that she was able to engage in was supported by her level of diversification, by her information access and infrastructure access as well in terms of access to banks, and strong social support systems. Now, social assistance does also play a role in these contexts, and it plays a role, what we've seen in these crises contexts is that it plays a role by supporting promotive and protective means of coping with crises. So in this figure on the left, again from our Borno 2023 survey, what we see is that social assistance was associated with a higher probability that households were able to grow cash crops, to have more livestock, to invest more, to share food more in response to conflict when living in areas where they had experienced climate-related disasters, all relative to not accessing social assistance. So social assistance clearly then is having a promotive or protective relationship for household well-being. And in this life history on the right, we see again, cash transfers does help in many cases prevent further downward mobility or even destitution. So I'll end by going back to this life history in particular to ask really, what does this mean then for people in and near poverty? What would have helped in this instance for this interviewee from Borno? For one, social assistance was accessed through food, for example, from Save the Children, just noted here. But ultimately, expanding social assistance coverage is really critical. So we need to go beyond humanitarian hotspots, focus really on areas, for example, of farmer-herder violence, drought as well. And we can discuss some of the questions that may arise around financing, perhaps in the discussion. There's absolutely then a need to strengthen conflict resolution and peace building, especially given that none of the sustained escapers in our sample had directly experienced violent conflict in our qualitative insights. There was also what we saw would have helped in this case is a mix of social assistance with economic policy support, and economic policy support that was more attuned to questions around equity. So things like health insurance or free health care, mitigating the economic maladaptive policies, all of that would have helped this individual, land policy or support. And while Nigeria is doing relatively well in terms of education, its access, its certain types of supports, what is really needed in this context is more attention to social assistance and insurance, especially in areas of health and the economy. So ultimately then I'll end by saying what we really need is social assistance, a focus on addressing the responses to violence, so for example, peace building especially, and economic policy responses that are ultimately more crisis and equity sensitive. Thank you.
All right, thank you, Vidya. Though you took a little bit more time. So we'll quickly move on to Fred so that we will have enough time for the Q&A. So Fred, please, could you go ahead?
Thank you, Victor, and thanks, Vidya. Very interesting. Let me see if I can share my screen. Okay, are you able to see?
Yes, we can see your screen now.
Slides. Let me just see if it's working as I skip through it, because I'll have to look at it. Okay. So let me just quickly introduce what this study is about. This is one paper out of 3 papers being produced through the BASIC program. There are 3 case studies looking at targeting of social assistance and including humanitarian assistance in crisis contexts. There's one on Niger, and one on Nigeria, and one on Ethiopia, and this is obviously a study that focuses on Nigeria. So I'm just going to give a very brief overview of some of the key findings around the welfare analyses that we undertook as part of these studies, and then jump straight to some of what I felt were the kind of concluding points and the implications for social assistance policy, again, including perhaps humanitarian assistance within that. Yeah, just to help inform this discussion and give you an overview of what this case study is all about, although it's quite long and there's a lot of detail. So I'm going to skip over a lot of that and just kind of cherry pick some of the things to talk about. And the first is obviously just to sort of look at the overall context that we're talking about, and that video and presentation articulated so well, which is that in Nigeria,
Sorry, Fred, you have some black boxes over the slide.
Let me see if I can. Does that help?
No, not really. Okay, that's fine.
It's helped? Okay.
Yes, that's okay.
Okay, so the first thing is obviously this context of violence and insecurity, plus all the other kinds of shock that households face, and large number of households face. The graph on the left here, and I don't want to get too detailed into the numbers, but it just shows the number of fatalities according to the ACLED database between 2009 and 2022. And you can see there was a sort of, starting from relatively low numbers, it started to peak from 2012 onwards as the Boko Haram insurgency kind of really took off, and then fell off after 2015 to 2016, but has been rising in recent years. And you can see from the colors there that these violent incidences that result in fatalities are very heavily concentrated in the north of the country, in particular the north east and the northwest in recent years. And you know, as the case studies in Vidya's presentation exemplified, you know, this violence doesn't only cause injury and death to the people who suffer it directly, but it can cause population displacement. It destroys infrastructure, both public and private infrastructure. It disrupts livelihoods. It disrupts markets and access to markets. It prevents access to basic social services like health and education. It can contribute to food insecurity, and of course is as the video study also shows, is related to poverty and including chronic poverty. So it's a really generates a really challenging environment for all, you know, for all dimensions of well-being and just trying to live life for the population. And on top of the violence and insecurity, households are subject to all manner of other kinds of shocks. And the graph on the right just gives a kind of overview of the kind of shocks that households report being subject to. That this data comes from the General Household Survey, the GHS. And you can see that, you know, violent events and death are one, illness or another, but there's shocks that relate to income and jobs. There's shocks that are climate, you know, originate in climate conditions like poor rains and floods and pest invasions, you know, shocks to do with livestock and non-farm businesses, as well as price shocks. And the issue is that households are continually subject to these shocks, and through the GHS we found evidence to suggest that households and communities are kind of losing their capacity over time in the continuing face of these kinds of shocks. And so they're not only, you know, managing to tread water and stay above, but sinking below. And I'll come to that again when we look at some of the poverty dynamics that we looked at in the study. In addition, in recent times, we've seen that the price shocks have really contributed to food insecurity. That was something in the latter stages of the GHS from 2018 to 19 really became apparent. And it suggests that in subsequent years, especially given the kind of global inflation crisis that we've all been living through, that might have had a further impact on poverty. On top of this, there are real challenges with the labour market, which effectively are a lack of kind of well-paying or adequately paying wage employment. And that, alongside with the lack of investment in infrastructure and human capital, mean that livelihoods just aren't proving an effective mechanism for lifting people out of poverty. So it's a very challenging environment is what we can take note of there. Let me see if I can get to my next slide. Another important kind of contextual issue to look at is the overall shape of the welfare distribution. This is a graph that plots that, and it shows that the vast majority of people, you know, the 80% of the people are all on very low consumption expenditure, and then there's a very small proportion of people who are on very high levels of consumption expenditure. So it's a highly unequal consumption distribution. And this graph is from 2018-19, but if you plot this same graph across previous waves of the GHS, it's a very similar shape. I mean, it's not really changing over time. And poverty analysis conducted by the World Bank have shown that the poverty trends have remained basically static in the decade between 2010 and 2019. There was a slight reduction of poverty leading up to 2015, but following the recession of 2015-16, poverty, you know, kind of regained its pace. So there really hasn't been much change. As Vidya's charts showed as well, her maps, that poverty is very much concentrated or higher in the northern parts of the country. It's associated with those who work predominantly in agriculture as opposed to being in wage employment or non-farm enterprises. It's higher amongst children and amongst older groups, and is higher in rural areas than in urban areas. And again, due to COVID and the cost of living crisis, you know, my guess would be that poverty is likely to have risen, especially given the situation with conflict and instability in the country as well. So this distribution also has implications for social assistance policy and other policies, in that one particular implication that we were interested in is the ability to distinguish between those who are poor or very poor or not so poor or non-poor. And given this very flat welfare distribution, that is a very tricky thing to do, as I'll conclude shortly. The last graph I want to show you is just this, which looks quite complicated, but hopefully is not too difficult. It just shows that the bars on the left, which go from dark blue at the bottom to dark green at the top, are the consumption quintiles. So, or deciles in this case. So, you know, if you're in the bottom, if you're in the blue, you're in the bottom 10% nationally. And what this shows is that people move in and out of different strata, as different welfare strata all the time. You might be in the bottom quintile in 1 year, and then 2 years or 1 year hence you've moved up or moved down, and so forth. So there's a high degree of movement between consumption deciles. And given that the bottom 8 deciles are all in and around the poverty line, a lot of this is movement in and around basically different tiers of poverty. And this flux of households, which also is referred to by Vidya, is emblematic of a high degree of vulnerability and very low levels of resilience among the population. And again, I thought that came out well with some of these case histories, where you can see 1 minute someone's got their business and the next minute some event has happened and it's all fallen through. So it just, you know, kind of brings to life this flux which this graph demonstrates. So what does it mean for social assistance? Well, again, as the more recent data from Vidya shows, there's little in the way of routine social protection to mitigate these welfare dynamics. And what we've seen in more recent years, as that coverage has gone up slightly or somewhat, is that that's really driven by food assistance, very often humanitarian food aid, but in some places it's also school feeding, which you might put as more of a kind of routine social assistance. But the coverage overall is very low. And the other key point, I think, which is worth recognizing, is that social assistance by itself is not going to solve all the myriad problems facing the majority of households in Nigeria and preventing them from escaping poverty, unless it was given at huge rates of coverage and at very high levels of adequacy. It's just not possible to do that. And that's not the job of social assistance either. Another key point to recognize is that though social protection or social assistance and humanitarian aid often share mechanisms like cash or food, they often have very different objectives and very different underpinning principles. And that means there's a really strong need to coordinate between them to ensure that they're complementary rather than kind of contradictory or confusing. And the national actors that we've spoken to in conducting this study and afterwards have cited often a lack of coordination as one of the challenges that relate to social assistance response in this context of violence and insecurity, plus all the other compounding shocks. For example, when you've got many actors delivering all kinds of programs, each with a different set of rules, differences in the types and the values of support that they're given, these things combine to create confusion amongst the population and amongst the beneficiaries, and opportunities for manipulation of the system by local actors. A couple of words on the context.
Right.
Yes.
You have just 2 minutes left.
Okay, thank you, Victor. I think I can do that. Yeah, so a couple of thoughts on the operational context, mainly around the kind of politics and perceptions of social assistance programming and targeting in particular. In the main, with the kinds of programs that have been delivered over the last, so many years in response to this context, they've used a combination of categorical and community-based targeting approaches. And in more recent years, there's been this effort led by the World Bank to build a national social register. So that also gets used, but that's layered on top or underneath of community-based approaches. And there's a real dearth or lack of evidence about what the population itself and what beneficiaries and non-beneficiaries and local level stakeholders think about and how they perceive targeting. But what evidence there is suggests that although on the face of it, community-based approaches might appear as being comparatively legitimate in the eyes of the local population, that's not always the case. There can be perceptions that formula-based methods or categorical methods can appear more legitimate due to perceptions around manipulation of community-based approaches or information imperfections amongst community-based targeting approach implementers. So again, there's not a huge amount of evidence, but another basic study also looked into the kind of politics of targeting within Nigeria and found that one of the key concerns amongst all stakeholders really was that political influence over targeting processes and outcomes is a major concern. So what do we conclude in our study? Well, in relation to targeting, what we found with a series of modeling is that poverty targeting in Nigeria is very difficult. It's plagued by two inherent challenges, really. One is that given the nature of the welfare distribution, proxy means tests struggle to accurately distinguish between poor and non-poor households at any given point in time. So there's a high level of inbuilt error of inclusion and exclusion using PMTs. But also that because households move in and out of poverty all the time, very frequently, whereas targeting for social assistance programs tends to be quite infrequent, it's difficult to justify, targeting one set of poor households 1 minute when a new set of poor households will be excluded the next. So I think there's an ethical challenge there around poverty targeting in this kind of context. Inclusion and exclusion errors tend to be very high when trying to select people in poverty, no matter what targeting mechanism you use. So whether you use categorical or means-tested approaches or combinations, it's really tricky, and that has to do with the nature of the welfare distribution. And trying to identify food insecure households and populations is even more challenging than trying to select the poor. So there are things that you can do to try and distribute resources to places of highest needs. You can use geographic targeting. But there's a discussion in the paper around this because it's quite a complex thing to do. It involves lots of trade-offs, lots of considerations, especially regarding equity of treatment. And perhaps that's something that we could talk about in the discussion if there's time or interest to do that. I think that what this implies is that because social assistance is not going to solve all of the problems keeping or pushing households into poverty and keeping them there or preventing them from escaping it, perhaps there's a real need to think really clearly about what are the specific aims and objectives of any social assistance policy, and then tie the targeting criteria very closely to that and support communities to understand what the rationale is and therefore what the targeting criteria are, so that you can build acceptance and understanding about the targeting criteria being used from communities. And that will prevent communities kind of redistributing the resources that they receive on the basis of their own kind of more informal reciprocal support mechanisms, which are tremendously important to their survival. And for that reason, it's very useful to kind of build in mechanisms into your programs which are able to gather feedback from communities, from local implementers, pay agents, from beneficiaries themselves, so that you can inform the policy design so that it works as well as possible. Another point, again, which kind of comes out of Vidya's work is that social assistance needs to be coordinated with other policy domains. It's not going to do everything on itself. It has to be coordinated with other social services, economic policy, agricultural policy, including humanitarian response, and also, peace building efforts, and probably governance reform, to really kind of maximize and optimize the impacts that it can have. And then the last point is that there's a lot of infrastructure that could really facilitate, delivery of government services in general, but more efficient targeting of social assistance and prevention of fraud and manipulation in particular. And I'm talking about things like civil registrations, national identities, access to electricity, mobile network, even roads. Investing in these underpinning infrastructure could be a real boon to kind of the efficiency and equity of social assistance policy and other policies. So that's it for me. I hope I didn't overrun too much, Victor, but back over.
Thank you, Fred. You did overrun there. A little 4 minutes, but that's fine. It's okay. So just in the interest of time, we'll also quickly, do we have Joshua on the call and Steve? Yes, so quickly, Joshua, looking at what has been discussed within 6 minutes, could you, sort of share with us, what do you think?
All right, sure. Thank you so much, Victor, and really excellent presentation, Vidya and Fred. My name is Joshua Alade, and I work, I'm the founder of the Nigerian Youth SDGs Network. With what has been discussed so far, it's not far from the truth. These surveys were, research was done between 2010 and 2019, 2022, but I can assure you that it's gotten even more difficult as we are here today. I'm going to try to just talk about what roles can civil society organizations do with regards to the issues that have been tabled within this research. And for me, I think the first thing civil society organizations can really do is in the area of raising awareness on trying to ensure that we have policy coherence in the way that governments go through issues on reducing poverty in Nigeria, especially in places where there's been a lot of crisis. And it's all about raising awareness on highlighting the issues that can help really mobilize support for and influence policy changes that address the issues that are really affecting people that are really impacted by crisis at the moment. Another thing would be when we look at the service delivery when it comes to humanitarian support, it's for civil society organizations looking out for ways to work with government, because again, when it comes to issues of crisis, you find out that civil society organizations in Nigeria usually most times the first respondents when there's crisis. So it's just to find out ways to be able to create programs, like in the case where Vidya mentioned the household, where the woman mentioned that they've been receiving a lot of support from Save the Children. So it's finding ways to see how can we improve access to healthcare, education, and also helping to mitigate the crisis that people who are in poverty in Nigeria actually face. So looking for ways to improve the service delivery, supporting government with the technicalities is something that I would advocate for. Another thing which is really very important would be in the area of how we respond to disaster. It's in Nigeria, there's always constant floodings, there's drought. So how can civil society organization be able to provide support in this regard? And I would say that if we look at the structures in our local government, most times politicians don't even understand what disaster response should look like, and civil society organization just coming in to help strengthen the way that service delivery comes around and how we can respond to crisis effectively is really very important. And I also want to talk about something that is really dear to my heart, which is in the area of accountability. At Nigerian Youth SDGs, one of the things that we try to do is focus a lot around how we collect data to understand issues of poverty and how it's affecting young people. So people who are in crisis, how are they affected? What are the poverty dynamics that they are currently facing? Because with this data, it will be easy for us to be able to design effective solutions to the issues that people face. And Vidya mentioned in her conversation in the research around the issue on conflict resolution and peace building. And what I would say is that there's this issue when it comes to trust between people in Nigeria and between Nigerians and government and governance itself. So it's finding ways to be able to build this trust, especially even among community groups. And trust building is really very essential to be able to build rebuild support for communities, to be able to even find out where are the pain points, where are the places where there's post-conflict, where areas of post-conflict situations, and how can civil society organizations be able to help governments to be able to meet or reduce poverty in this regard. Finally, to wrap up,
yes, please wrap up.
Yeah,
you just have a minute.
Yeah, I'm going to be wrapping up to talk about the issue around right-based approach to development itself. What's the rights of the poor in Nigeria? Like you find out that somebody is doing well today, in less than 30 days, the person is doing really poorly. And how can we also ensure that poverty effort to actually reduce poverty is not just about economic improvement alone, but also talking about justice and equity, people being able to even have access to the basic needs of life, and then creating these opportunities for partnerships and collaborations. Civil society organizations are doing some work, but there's so much more to be done in being able to leverage support from international donors, even local businesses and the private sector to be able to support poverty reduction initiatives. Thank you.
Yeah, thank you, Joshua. Quickly, we will move to Steve. But before we move to Steve, please, if you do have questions, please post them in the question and answer box so that when we get to the Q&A, we'll be able to single out the questions and ask the discussants and panelists. So, Steve, please go ahead.
Great. Thanks so much, Victor. First, I'll keep my remarks brief. But thanks to everyone for both the presentation of the papers and the commentary. I think both are very important. Adding to what we see in the more mainstream media, whether local or international, for understanding what goes on in Nigeria, and this helps inform policy, the public, the different types of responses that are needed, so both in the short and the long term. Within the British High Commission for Nigeria, we've got a number of fronts that we have with different teams, with different departments, trying to address different aspects of the needs in Nigeria. So we have our trade and commercial relations, our humanitarian, so very focused emergency programs. We have other teams and programs focused on specific thematic areas also, education, health, and others. One thing that's come up recently that I'm rather excited and interested in, and also our humanitarian team, our governance, and our social protection team. And I think it complements very well the presentations and comments we've just had, is what's called the Social Protection Roadmap. And this came out of the Social Protection Cross Learning Summit of late June this year. And this is an ambitious piece of work, largely focused on improving both the reach and the coverage of government social assistance. But it's something I'm keeping my eye on for the various reasons that we've talked about, to include more people, to reach more groups. obviously, as Fred pointed out, social assistance in terms of what the government provides is just one form of supporting and reaching people. But I think this particular effort, if it can get traction, will be incredibly important because there's about 12 work streams to it, to broaden social assistance for the general population of Niger, both those in conflict and disaster affected areas, but the population in general. So I'm happy to share that with other members of the panel if they haven't seen it, and people that might be listening or watching in. Because I think if progress can be made on this front, it will be interesting to see how much of a bite it does take out of lifting people out of poverty or mitigating the rough edges, helping people sustain their way out of poverty. So there's a lot that needs to be followed, but I think this could be a very important yardstick in that dimension. So that's probably something I'm watching very closely over the coming months. I think the challenge that the social protection roadmap faces is the prioritization of the many things that it's aiming to do. It's supposed to have government oversight and a steering committee. It has many other moving parts, and all is sort of happening simultaneously, but there needs to be greater prioritization of certain efforts so that other things can happen. I think that's what needs to be sorted out quite soon, because if it has a 2-year time frame for implementation, if one really wants to see results by the end of that time frame, and ideally even sooner, the government and other key partners, such as ourselves and the World Bank, really have to make sure we know clearly who's doing what at what time, if things are off track, how are these remedied, to make sure there isn't ripple effects, and after 2 years there's still big gaps in what was hoping to be achieved. So I think coming out of the SPECS 2024 Summit and the Social Protection Roadmap, this will be something that I think all of us will have an interest in seeing how it unfolds and how it succeeds. So I'll leave my comments from there, injecting something a little new into the conversation, but thanks to all of you for all the presentations today. Thank you.
All right, thank you so much, Stephen. It's glad to hear that you're keeping tabs on the social protection roadmap here in Nigeria. Thank you all the presenters and the discussants. It's just been a 1 hour of very fantastic discussions, especially if you've been following the trend in Nigeria, where multiple crises are intersecting at various levels, and it's posing a really great challenge for the government, for civil society, and even for citizens. We will be going to the Q&A session, but before we go to the Q&A session, there are some lovely points that are coming up in the webinar chat, and I will just, just take a few minutes to just summarize some of those points that are coming out. A key point that has come out is it's one that comes from Fred's work, which it's stimulating some discussion here, which is around the mobility around poverty, how people move. And Joshua alluded to that when he said, today you could be fine in Nigeria, in another 30 days, you could be down the poverty. So that's how, movements occur. And the intersecting crisis is making these movements more faster. And it's such that while, like Jeremy noted, the World Bank data shows that poverty is has been static. And that's the general thinking in Nigeria, that poverty has been static for over a decade. But when you look closely, you see that poverty has actually increased in Nigeria. And that's some good point that is coming out from this discussion. And when you look at what video, from the discussion, what it's coming out is, look, within this context where we're thinking that poverty is actually stable, but we're seeing that there's a lot going in terms of poverty dynamics. And this dynamics is interwoven with intersecting crises. What can actually the government do? Particularly when you look at the social assistance, how far can it go? What can it really do? And like Fred pointed out, targeting to be a critical challenge within this very complex context. So picks all the questions that have been placed in the chat, and I will direct it to Fred, Vidya, Joshua, and Stephen, and I'll just pick randomly and direct to you. So this is basically to Fred. What sense did you get, of political preferences regarding targeting? Do this differ at the federal and state level? From your work, what did you see?
And that's a really interesting and difficult question, actually, Victor, because I think it's one of the big gaps in the evidence base around perceptions of targeting. What was clear, which doesn't come from our study, but comes from another basic study, was that politics is central to how programs are designed and how they're delivered, including how they're targeted. And that is often perceived by, at least what seemed to come out of that study, was that can be perceived quite negatively because it undermines and erodes trust in those programs. And there was a question in the chat, I think it's from Andrew Shepherd, about, you've got this context of high vulnerability and high poverty, your bottom 80% all kind of fluctuating around each other. So what do you do? I mean, can you just, does it matter who you target in that context? And I think this question does tie into this notion about what is it these programs are trying to do, and how do you build legitimacy and accountability and transparency and trust in them? And, how do you solve these problems? Can you target 80% of the population? Probably not. It's unaffordable, especially at meaningful levels. So what do you do? And to my mind, I think there's then it can be about, well, can you really specify what your program is trying to achieve? Maybe you've got a social protection program that's really focused on supporting the first 1,000 years of life to give people, the best chance from the get-go. And therefore you can design your criteria, your targeting criteria, to really match that and have those criteria make sense in the eyes of the population. So they know, yeah, okay, this is for all, newborn babies, pregnant and lactating women, and newborn babies up to the age of 2, for example. And that makes it easy for everyone to understand and accept and understand the objectives and why the targeting criteria is what it is, and minimize the level of manipulation or corruption or capture of those benefits. But there's a really important point about equity of treatment. If you're in one part of the country and you don't get this form of support, and you're in another part of the country than you do, in this context of kind of regional tensions or tensions between different population groups, that can be problematic. So to me, there is like that ethical consideration that has to be kind of explicit in the policy design and in the policy delivery, that, if you're going to use geographic targeting, for example, then perhaps that has to be, perhaps if you're going to, prioritize areas with the highest level of need, the highest poverty rates, or the most severe poverty, or whatever, or the most severe child poverty, if you were targeting young children, then perhaps there has to be a policy commitment to slowly expand that policy to other parts of the country, so that a poor child in one place who doesn't get that benefit knows they're going to get that benefit or have the entitlement to that benefit as soon as it's fiscally possible. And without that, you may just be contributing to these kind of tensions that are contributing to this overall level of kind of insecurity and violent clashes that occur. And just to come to one other question, which I think impacts on this same discussion, which was around this infrastructure. I mean, we looked at a couple of measures of infrastructure in terms of the kind of quality of the material conditions that people are living in. And what we found was that amongst the South, always, you know, whether if you're in a house or you've got access to electricity or improved sanitation or safe drinking water, in the South, you've got much better access than in the North. And the trend in the North, with the slight exception of electricity, which is slowly improving in most of the North, but not in the Northeast, at least up to 2018-19, that's likely to do with the Boko Haram insurgency. But largely, those conditions aren't getting better. So there hasn't been huge investment in these basic living conditions for people. And that is problematic. And that's the same for things like the road network, which is much worse in the north of the country than in the south, which makes, you know, getting to market, delivering on your livelihood and accessing services much more difficult for everyone and much more costly. And so, the last part of this infrastructure, which I think is super important, which is the civil registrations and national identities, is something that the country, I know, has been wrestling with for a long time and really struggling to make progress. According to the World Bank, you know, the legislative environment is now quite amenable to really improving and consolidating on national identities, but progress since 2016 has been really slow. So there's barriers there, and I suspect that they are political barriers that need addressing. And to me, is, you know, development partners should be coalescing around these things to help, because they will filter down to solving these problems like categorical targeting. You know, they rely on these civil registration systems to deliver. So anyway, sorry, I'll stop.
Yeah, thank you, Fred. Thank you very, very much for that. Vidya, just, you know, drawing from your presentation, it's like the link between which, you know, there's a question here, you know, which one should be strengthened within this context, this complex context we're talking about? Should it be the social protection aspect or the humanitarian response? Which should be given more priority?
Thanks for that question, Victor, and the questions in the chat box as well. Yeah, I think it's hard to speak about one without speaking about the other in a context where you are facing intersecting crises and high levels of poverty. Because yes, you could certainly strengthen the risk responsive element of by expanding humanitarian coverage, but if this is not done with consideration of equity and of reaching the poorest people in society, then you continue to have large segments of the population whose well-being continues to deteriorate. Other research that looked at conflict and assistance has also found that without explicitly targeting the poorest in situations of conflict, for example, they are more likely to be left out of that type of support. So that focusing on, yes, absolutely, on geographic areas of crises and expanding the humanitarian response and disaster risk management response is critical, but it needs to be done in both a risk-informed and an equity-informed way. And similarly, again, you can come to that same end zone regardless of that entry point, whether it's the humanitarian HDP nexus entry point or whether it's a social protection informed entry point. If it's the latter, having a stronger focus on crisis sensitivity, do no harm principles, and ensuring that, again, the response is, in that case, goes alongside peace building interventions. So you're working both in and on conflict, as some of our work has pointed to, is also quite critical, and in context of intersecting crises, not just conflict, but of course the various climate-related disasters, the economic crises that permeate both because of and alongside these other crises.
All right, thank you very much, Vidya. That was, you know, just a question following up on what strategies do you think are needed within this context to sort of balance social protection and humanitarian assistance? You know, there is this talk of, look, we need to reduce humanitarian assistance and move to some other development issues. So what strategies do you think are needed to maintain a balance there in terms of policies?
Yeah, that's a good question. And I think, I mean, we always speak about the need for stronger coordination, the need for stronger financing, and it's also been raised in the chats about how to finance given the level of needs. And I think there's different ways that we can go about this. In terms of coordination, I think there's a need to have people in those roles who are coordinating, perhaps better versed in issues related to change management, given that context situation of flux and uncertainty. So I think that's an important skill set for the people in those roles. I think also beyond that, we can think about, for example, mobilizing climate finance to support spending on some of the shock responsive elements of social protection, for example, and our findings around the destructive impacts of floods amidst these contexts also would support this type of intervention. If you look at the aid sector as well, yes, Nigeria does receive a large value of aid for social protection, but if you consider aid per person, and I would assume which we'd have to look into, but I would think also aid per poor person, the value is quite small. So yes, you can't, it's inadequate to look at the overall figures without considering, again, the demographics and the contextual realities that might portray a very different situation and a very different allocations story.
Thank you very much. Fred, I could see you have a hand up there.
Yeah, just wanted to come in. I thought that it's possible that there are experiences elsewhere around how to kind of bring together and coordinate better humanitarian response with routine social protection. I think I
lost everyone for a moment. Yeah, Fred, I did see your hand up. Go ahead.
Yeah, so I was just going to say that there could be some instructive experience elsewhere about how to, useful ways to bring together and coordinate humanitarian response with social assistance. I was thinking in particular of in Ethiopia, where there was a big drive around the PSNP, which, to coordinate the delivery of PSNP with the huge volume of humanitarian food aid that was delivered in the country. And this agenda has been pursued over a large number of years, but it's been trying to bring together these two streams of assistance in a more coordinated way so that there's less gaps of people falling through the safety net, and more equality of treatment and equity of treatment, and harmonized systems and processes between the two. So there could be some instructive experience there. And again, in Kenya, especially in northern Kenya, where there's been the hunger safety net program that has had to incorporate emergency response with routine social protection, and they've had 10 years of experience in doing that in contexts which I'm sure share some characteristics of Nigeria, like large populations of pastoralists, herders and so forth. So it could be useful to go and take a look at the experience of these kinds of places which have been trying to coordinate these two policy domains over a number of years, to see what would be applicable and useful for the Nigeria context.
All right, thank you very much. We do have just a little over 15 more minutes, and I will begin to wrap up. This will just go to Joshua. Now, Joshua, listening to what Vidya and Fred have just described, which is presented a very complex situation. And I know you talked a little bit about the CSOs, that's the civil society. In recent times, we've seen that it's become very difficult and challenging for civil society organizations to engage and advocate social assistance in this dynamic context. So what do you think it's needed to drive more civil society engagement in terms of expanding the coverage of social assistance?
Thank you so much, Victor. My simple answer to this is collaboration. Collaboration with business. You know that government would always listen to business, and the body language of the present Nigerian government is also asking how can business support them. So now it's for civil society organizations to look out for innovative ways to engage government by bringing business alongside with them. It's the only way that we can move forward when it comes to social assistance. Nigeria is currently experiencing like a distortion in our civic space. Civic freedom is becoming very difficult. So it's making it difficult for civil society organizations to want to hold government accountable. So if you bring in business alongside CSOs, it would be easier for us to get this done. And in getting this done is also leveraging on the technologies that private organizations will bring into place. And there's been a lot of conversation on cash transfers. And in Nigeria, you find out that this is also riddled with corruption. So if a business or the private sector is coming in, for instance, we're bringing in mobile money into place. So it's not going to be just giving people cash anymore. It means that there's going to be a digital means of doing this. So it opens up, it gives ways for transparency. And it's also the opportunity we've talked a lot about targeting, trying to find out who are the people who are facing issues of poverty, who are the people who are really poor, and those who really need help. And then bringing in business into it would help us to be able to meet that goal of achieving community-based targeting to be able to solve the issues around poverty, and then within the lens of doing no harm and also providing equity and justice for everyone who is affected. Thank you.
All right, thank you, Joshua. And Stephen, just a few words from you. I will just direct this to you. Now, you talked about the British High Commission having funds to support a number of works. And so from the discussion, you've seen how complex the situation is now. So what do you think? What kind of support do you think the British High Commission can bring towards supporting social protection and humanitarian response? Particularly, I understand that some social protection programs of the FCDO may be winding off at a time when the need is higher. So what are your plans in supporting the country?
Yeah, I actually thought Joshua made a very nice point about, I'll get to the main aspect of your question in a second, but I thought Joshua made a very nice point about work of civil society organizations engaging with the business community, because if you go back to the social protection roadmap that I mentioned, one work stream through that is actually extending social protection to the informal sector or informal economy. And of course, that's a big aspect of the landscape in Nigeria. So I think those sorts of organizations that deal with workers' rights, social assistance, social protection, there's a big space for them right there to engage on. And that's the kind of, I think, insight and input that the government can benefit from, but also ourselves too, as international donors who are really pushing, not only in Nigeria, but globally, localization, a more prominent role for civil society organizations to balance or better calibrate the support that's given, across the humanitarian and development landscape, so that it gets to those organizations that are really at, the grassroots, the field level, who may still be implementing partners of larger organizations, but many aren't, and many do extremely good work, but are challenged by the resources that are increasingly becoming constrained. So I just wanted to comment specifically on that. I think within our own ranks, in addition to being cognizant of that, we really have to focus on the drivers of conflict in Nigeria as elsewhere. In some cases, humanitarian support, for example, is incredibly important, incredibly needed, but it can often be rather reactive. So we have to look at really, what are some of the issues driving conflict, and not just the Boko Haram that's largely concentrated in the Northeast, the so-called herder pastoralist conflict in the Northwest. And some of the key issues there are land issues. So the competition for land, issues of land rights or land tenancy. How too is climate affecting that whole sort of domain and driving this competition for land further south in the country. It's not just simply a Northwest Nigeria issue. It's something that's moving southward and southward. And this is where you could really get at some of these other types of assistance that are, let's say, more on the proactive side. And here we are, and I think it was Vidya mentioned earlier, talking about conflict resolution and peace building. These types of interventions, support or assistance are crucial. So, you can have your, let's call it more traditional humanitarian support, which has its place. You've got government social assistance, which is incredibly important and needs to be improved in the ways I mentioned earlier. But if you don't get at some of these conflict resolution, peace building needs, you're only kind of getting half the picture. You're only addressing really half the story. So I see those types of interventions that we're now starting to do more of, that will be incredibly important and real cornerstones of our work, moving forward and broadening our scope beyond the Northeast. Thanks.
Yeah, thank you very much, Steve. So we're gradually coming to the end of this webinar, and it's more like the discussion should continue because it's getting more exciting and more interesting. But I think there are other platforms and other avenues where we can continue to have these discussions, where we could continue to share ideas on what we need to do. But, the takeaway from this webinar is key. And that's something that Vidya pointed out in a paper, which I think a lot of people need to understand, is that the concept of social assistance in Nigeria is still quite a heavily debated concept, because it's still not understood clearly. There's still a lot of misunderstanding. There's still a lot of debate around what exactly is social assistance? What should it do? Who should provide it? Who should be doing it? And all of that. And the multi-tier system of governance in Nigeria introduces further complexity to this question of understanding the concept of social assistance. And I think clearly there's been some move to see how to link the social protection sector and the humanitarian sector, but that has not really taken off. And I think this is where a lot of support may be needed for the country to begin to link these areas together and see how we can move from that reactive humanitarian response to a more longer term development thinking, which I think will address the issues of conflict resolution, peace building, and all of that. And I think, finally, on a final keynote, something that we need to also begin to think about and think is that those social assistance or those social protection in general, does it have any way of contributing to peace building, to conflict resolution, to reducing communal conflicts, which are very prevalent, to reducing issues around land rights, resource rights? Does social protection have a role to play? And I'm linking this to Fred's work on the trend of welfare. If you have a context where the consumption of 80% of the country is very poor compared to the 20%, what is the implication of that for us as we think of coming up with policies to respond to the dynamics of poverty within this sort of complex context? So I want to thank everyone. Fred, thank you. Vidya, thank you. Joshua, thank you. Steve, Thank you, Tabisa, who's been at the back. Thank you very much. And thank you to everyone who has taken the time out to join this webinar. I hope that we've had a very fruitful conversation, and we will take this conversation further wherever we find ourselves. Thank you very much, everyone.